Hi, my name is Guerra, and I participated in health practicum during my senior year of 2024 to 2025. I enjoyed this class and the experience it offered me very much, so I thought I'd share my journey. My first site was found by my mom. Her good friend, Dr. Hammond, had a practice called Hammond's Family Dental. My first day was probably the most confusing. It was a new experience and I didn't know what to expect. I didn't have scrubs and I felt kind of weird showing up in my leggings and hoodie when all of the dental hygienists and orthodontists had their black scrubs on. So immediately after this day, I got my black scrubs for the rest of the year. Get your scrubs before the first day. When I got there, a really sweet receptionist greeted me and took me to the back of the practice where I met Tammy, my practicum sponsor. Tammy is a really sweet woman and she could tell I felt out of place, so she got me one of their practice jackets that had the practice name on it, so I didn't look like I was just a patient. I really appreciated my first site as Tammy, who is a dental hygienist, allowed me to spend the full time with her, and she taught me as she worked on patients. My first responsibility was dental coding, which is basically while Tammy calls out numbers that have to do with gum recession, calculus on teeth, and other oral hygiene observations, I got to type those out as she was calling them out. My first day, made a lot of mistakes. They had to redo it for me, but as the days went on, I got better at finding the codes on the computer, and that was just my first day. So from then on, it got even more involved. I was talking with patients. I was talking to the orthodontist. What I loved about this site is how much socialization and how many connections I got to make with the orthodontist, hygienist, and with the patients. It was a very comfortable and inviting environment, and so I got to learn openly with the patient's consent. I also got to write all the information I learned down in my journal, and I learned so much those first couple of days because I had no idea what went on in a orthodontist office. I wrote all of that down in my journal. But about the journals, that's one thing I really want to instill in future practicum students. Pay very close attention to Ms. Zumwalt's directions those first couple days and weeks of instruction. I made the mistake of misunderstanding the due date for the journals. For some reason, I misheard that every practicum Friday we'd be coming in and showing our journals from the previous practicum days. But I got a little suspicious when I started getting missings, and practicum Fridays were not that often. So I eventually found out that the journals were due every day at your site. And so that was a little disappointing because it was hard for me to catch up. And I felt like a lot of those journals where I had so much passion going into them about what I was learning kind of went to a waste. I was only at Dr. Hammond's for 3 weeks. And while on the last day he offered me to stay longer, I had already accepted my next site, which my mom also helped me get. Walden Cosmetic Surgery Center. While this next site wouldn't allow me to be as talkative and comfortable, it would provide me with amazing hands-on opportunities to learn about my future career as a CRNA. The first day came with a lot of shock. I arrived and met with my sponsor, Taylor, who led me to the OR after teaching me how to put on my cap and my gloves. I was surprised they would let me observe a surgery on my first day, and I was even more surprised when I walked into the OR and saw pieces of a patient's labia on the OR floor. Dr. Walden is a very strong and independent woman, which can cause her to be a little snippy with people sometimes, which I would learn even more as the year went on. The second I walked into the OR that first time, she immediately goes, "Anyone want to tell me who the hell is in my OR right now?" And everyone just looked around and I was so nervous. And Taylor introduced me to everybody. Dr. Walden didn't acknowledge my presence, but I'd have to wait 6 more months for her to acknowledge me by my name. And that's another thing I want to instill for future practicum students. When you are at a site that is as busy and as serious as mine and a lot of my peers were, it's important to remember that these people's job is to not spend all their time to cater to you. You have to assert yourself. When you see an opportunity to learn, and when you see an opportunity to stick up for yourself and say something and make your presence known, definitely take it. And that's something I wish I learned earlier on, because I missed out on a lot of learning experiences because I was too afraid to speak up. As the semester progressed, I met one of my favorite nurses, Rachel. In her spare time, she would show me patient files and explain to me surgeries, how they're performed, before and after pictures, post-op procedures, pre-op procedures. And it was really cool to not only get that surgery experience where I got to observe what was going on in the OR, but I also got to see the after effects and the work it takes after a surgery to see the correct results in the patient. Nurses like Rachel and another amazing nurse I met named Ronnie, whom I connected with so much over the second part of the semester, I found a lot of women to look up to in my future career. Not just our CRNA Tony, the only guy in the whole practice. He was really sweet. He gave me tips on nursing school, how to be a CRNA, what sort of internships to pursue. And so that was really helpful. And so another thing I'd suggest is do multiple sites, because you want to get a good look, because you're not 100% sure what you want to do for your career. But once you kind of narrow down your interests, I would certainly say find a site that you plan on doing in the future, a career you plan on pursuing. And so seeing that was really cool. After getting to observe so many cool surgeries I never thought I would see at my age, like I saw autoplasties, ear pinning, I saw upper and lower blepharoplasties, I saw facelifts, I saw neck lifts, I saw breast augmentations, I saw implant exchanges, I saw capsulotomies, I saw capsulorrhaphies, I saw rhinoplasties, I saw BBLs. It was so cool. And getting to observe those every day was awesome, and I didn't think it could get better. But one day, Dr. Walden, she turns around and sees me in the OR observing during a breast lift, and she goes, does she want to scrub in? I could use her help. And obviously not acknowledging me. And I was like, yeah, I really do want to scrub in. I felt really nervous. I went over the general procedure for scrubbing in that Karen, one of the nurses, had taught me during one of my first days. So I went outside of the OR, I sanitized my hands, I came back in, I donned the gown with Karen's help, and I put on my surgical gloves, and I stood by the OR table waiting for Dr. Walden's instruction. Dr. Walden grabbed the sky hooks and connected them to a piece of fascia on the breast tissue and offered for me to hold them. And after that, later on in the procedure, she offered me to staple skin together, to staple fascia to hold the breast tissue together while she got an overall view of what the breast would look like after the procedure. She let me cut suture tails on sutures she performed on the patient. I knew right then I needed to pursue a career in healthcare because it just brought me so much joy. It was the coolest feeling I've ever felt. These assists continue for the rest of the year. I'd arrive, Rachel would come into the break room and be like, Dr. Walden requested you again. And that was so cool. I actually felt even more a part of the family and that I was actually contributing to what was going on at the surgery center. So as I go to Texas A&M this upcoming semester to get my BSN in nursing, I really have this passion and this drive for this career. I have this class to thank. And I want future practicum students to really enjoy their time here in this class and to listen to Miss Zumwalt so you don't get a lot of bad grades on journal. Read the syllabus. It takes 5 seconds. Thank you.